name is Beth Govro, and I serve as the Vice President and Chief Nursing Officer here at SSM St. Mary's Hospital in St. Louis. And I have the honor of spending time with Tiffany Sellers, one of our high-performing nurses in our emergency department. And we're very excited to do this interview and learn more about Tiffany and the great work and care that she gives to our patients. So I'm gonna first turn it over to you and just want you to tell us about yourself and how long you've been here and anything that is also of interest that you want to share.
Well, I'm 27. I'm engaged. I have an 8-year-old daughter at home. I've been at St. Mary's, if you count when I was here as a technician. I was here for about a year, starting in 2016, and then I was kept on as ER nurse when I graduated, so a total of like 4.5, 5 years, I guess.
Wow.
And I've always been in the ED. I love the ED, and it's my home.
So you're an adrenaline, you like the adrenaline
Yes.
rush?
It's my place.
That's amazing. What made you go into nursing?
So the honest answer for that is when I was thinking, because I did have my daughter young, so when I was going to college, I was like, how can I get out and get started and build my life for my family as fast as I can? But I wanted something that was going to be steady, and when I looked at everything, it's like something in healthcare. Like healthcare is always going to be around. People are always going to need to go to the hospital. It's always going to be a necessity. So I said, obviously I'm not going to be a doctor. That's like 8-10 plus years of school. And I'm like, well, I'll do nursing. I consider myself someone who cares about other people, and things always change in nursing. So you can always move on if something doesn't match, or you can always try something different. There's so many things to try in nursing. So I gave it a shot, and I'm here.
Wow, that's great. Well, we're glad you're here and glad you work in the emergency department. And working in a busy department, especially with not knowing what's walking in the door, coming in through an ambulance, what's been a patient story that or situation that you remember and kind of just sticks with you that you just kind of have carried throughout the years of your career?
So I get that question a lot, especially by people that I orient, and it's like, I know that they're looking for like this super exciting, crazy story that happened, and what I tell them, it's like, it's not really the ones that you save that stick with you. It's the ones that come rolling through that door, who everything happens so fast, you don't know who they are, what's going on, but you know that they need your help, and they don't end up making it. We've had really young ones that roll through the doors down there, and it's just really sad to be able to have to go out there and tell their family, like, we did everything that we could, we're very sorry, but your family member has passed. And those are the ones that stick with you, because it's the learning experiences that make you think, well, what can we do better next time? So those are the ones that really stick with you and make you be like, this is why I'm in this career, this is why I do this, and just make you be better for the next time.
Wow, that is an amazing answer, and I appreciate your honesty. Those are the toughest situations, and nursing being one of the most trusted professions in the nation. There's a reason we're called for that, because we're there at the healthiest times, the sickest times, and happiest, and the unfortunate sad times. So I'm glad that you're there for our patients when that happens.
Absolutely.
So what about SSM and St. Mary's has kept you here working with us?
I love the people that I work with. I've said that from the very beginning. I was very scared, because it's always scary when you start somewhere new. Like, nobody knows you. You're at the bottom of the totem pole. Like, will they like me? Will I like them? And it's just, not only is it the ED, but like people on the floors too. Like, everyone's very easy to talk to and get along with. And I consider myself an introverted person, so I'm not one to like jump into a conversation. The people downstairs, they make that so easy. I love my charge nurses. I love my coworkers, the other staffing nurses that work down there. I love my management. Like, everybody is just welcoming, and they've been like that since the day I walked through the door.
That's great. Well, you're very easy to talk to.
Oh, thank you.
Very nice as well. So a little bit off subject of nursing and healthcare, what is kind of some interest in hobbies do you have outside that kind of helps you decompress?
Well, I've traveled away from them, but as a child and like in my teenage years, my family, we were big into horseback riding.
Oh, wow.
So, but I haven't been able to do that in a while, but actually just this past year, my fiance took me and my daughter on a horseback ride out in Branson, and it was the most amazing thing that I've ever experienced. It was really a way to just unwind. But other than that, like horseback riding, I read a lot, and just being with my daughter, like I'm able to go home and leave it at the door, because I know that walking through the door every day, like she just wants to see a smile on my face. And knowing that I smile, like I'm gonna cry, sorry.
No, that's okay.
She goes, Mommy, I think I want to be a nurse when I grow up, and that's what like warms my heart, because she doesn't see the bad, but I come home every day and it's for her that I do this, so it makes me happy.
Well, you're gonna make me cry.
I'm sorry.
Yeah, that's awesome.
Yeah.
So, you know, as you go through your career, you hope to kind of, as you orient, as you take care of patients, you work in your department. What do you hope what breadcrumbs do you hope to leave behind as you go throughout your career?
That's a really big one for me, because even going through nursing school, my biggest thing was I don't want to be that experienced or veteran nurse that looks down or makes other new nurses feel belittled, because that happens. Like, it's what we were told in nursing school, we eat our young. So, and it happens, and I told myself from the moment that I started precepting, like, I want to be that person that anyone can come to, and they don't have to be afraid to do that. And I get that from all of my orientees. Not that I'm not the greatest or anything like that, but they say, if I have to go to anyone, I'm going to Tiffany. And that's what I want. I want people to feel like they can have someone that they can go to, and I want to be there for everybody, even though I can't be, but I'm just like, you need anything, I'm here. So I want to help others get to where they want to be. This is kind of like what I would say would be my breadcrumb. I want other people to be able to get to where I see myself now.
That's wonderful, and that's why Tiffany is one of our high performers, and we are just blessed to have her working in our emergency department and taking care of our community and our patients, and her leadership just speaks volumes of the big heart and the care that she has for her peers and our patients. And so I just want to thank you for your service and for working with us and for sharing your story.
Not a problem, I'm glad to be here.